Wuhan out of lockdown. China lifts restrictions on the city where the coronavirus pandemic began 4 months ago. But is it too early? And what are the lessons for the rest of the world? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. Much of the world is now imposing strict lockdowns to stop the spread of coronavirus. But the Chinese city where the pandemic began is easing restrictions after a sharp fall in new cases. 11 million people in Wuhan have been sealed off from the outside world since late January. A giant light show counted down the moment when people were allowed to leave the city once again. China's government is hailing this as a milestone in the global fight against COVID-19. But questions have been raised about whether China has been underreporting its number of infections and deaths. Health officials are keeping a close watch to avoid a second wave of infections, as Sarah Clark now reports.
Packed and ready for departure, tens of thousands of people from the city of Wuhan are on the move after 76 days holed up in their homes.
I planned to go home during the Chinese New Year, but because of the epidemic, I didn't get to do so. My family asks me every day, when can I come home?
The lockdown has been gradually lifted over the last 10 days, with inbound travel allowed, but no departures. On Wednesday, all major highways were reopened. So too was the city's airport. At least 55,000 people bought train tickets to travel to other parts of China.
I haven't been out since January 21st. This is the first time I've left the house. Now I'm going back home to meet my parents.
Checkpoints remain, but for health scans. Those passengers carrying a green code on a government health app are considered low risk and can travel.
We will have a follow-up disinfection of passengers at the entrance and exits on the railway station. The temperature screening and the health codes checking are very strict.
11 million people live in the city known as a key industrial hub of China. In December, hospitals in Wuhan reported the first cases of the coronavirus, with an increasing number of patients complaining of flu-like symptoms. In January, the city was put in lockdown after it became clear that the flu-like virus was highly contagious and potentially deadly. Residents were trapped, so too were workers, on the eve of the Chinese New Year holiday break, including Claire Hu, who works and lives in Beijing.
But all my other friends or colleagues who were actually from Wuhan, they cancelled their plane tickets last minute, but I didn't because I chose to come back earlier before them. So I felt like now I've been left out by everyone.
Wuhan accounts for more than 3/4 of coronavirus deaths in China. Authorities are warning of a second wave of potential infections as lockdowns are lifted across the country and people return to work.
We appeal to the residents of our city not to leave Wuhan for non-essential travel and continue to leave home as little as possible.
The recovery of Wuhan has been watched worldwide. While the city attempts to return to normal, the trauma could last for decades. Sarah Clark, Al Jazeera.
Let's introduce our panel. In Hong Kong, Dr. Arisina Ma, the president of the Hong Kong Public Doctors Association. In Lancaster, in the United Kingdom, Dr. Mohammed Munir, a lecturer in Virology at Lancaster University. And in Piacenza, in Italy, Dr. Gloria Taliani, an infectious disease specialist and member of the COVID-19 task force of the Italian Civil Protection System. Welcome to you all and thanks for your time. I'll start with you, Arisina, in Hong Kong. Wuhan has lifted its lockdown. Is it too early?
I understand that people living in Wuhan has been locked down for quite 2 months. It's quite a long time. They are really looking forward to this day. Some of them actually are not local resident. They are just travel there to work or start a business, but they have been locked down there. So from yesterday news, many of them just tried their best to return to their homeland. However, we do in Hong Kong. We do worry much about the opening of Wuhan again, because Wuhan is the one of the provinces who are most heavily attacked by the SARS-CoV pandemic in mainland. Though they announced that the official data from mainland government announced that there are no more new cases in Wuhan for a long while. However, they still produce quite a major number of death row in mainland. So that make people worry that whether the truth is they do not have any new cases, or they still have a small cluster of local cases appear in Wuhan. So Hong Kong people worried it a lot, because our first cases are from people from taking the high-rise train from Wuhan, and Hong Kong have many connection and many travelers from mainland. Wuhan is one of the provinces that they have many travelers visiting Hong Kong.
Mohammed Munir in Lancaster, after 10 grueling weeks under lockdown in Wuhan, was it too early to lift the lockdown?
Well, I think there are certain features of this virus that make it a little more complicated than any other straightforward disease. I mean, we do know a fair proportion of people who are infected, they are asymptomatic. And asymptomatic infections have been detected in China at vast scale, not too long even. I mean, it's last week as well. So although they claim like 2 weeks approximately, there have been number of cases have been significantly dropped, and in the last week the number of cases were lowest, and then slowly depleted. I would still be very cautious to lift the lockdown completely, but I do understand that not only that they have a certain control and restriction onto the people who can go out with the green QR code, but also they have made it very clear that only essential people who are in the industrial or with the medicine supply, or people who are working with the supply of those chemical and reagent, those are essential to do so. But extremely cautious nature need to be adopted in coming days, because this virus is not a usual virus.
Gloria, so they're nervous in Hong Kong and cautious words from Lancaster. Are you nervous about Wuhan lifting its lockdown at this stage?
Well, given that the lockdown was necessary because it was necessary to make a cut from the previous, our previous habits, our previous way of living, therefore it was necessary to change our attitude to the new epidemic and pandemic. But it's obvious also that at a certain point we have to readmit normal life in our social schemes. So given that more than 70% of people are asymptomatic carriers of the virus, it's impossible to imagine that there will be a perfect time to stop the lockdown. The perfect time is probably the time when people understand that they have to change their habits. They have to wear masks, they have to maintain distance, safe distance from each other, and they understand that the burden of the disease is apparently controlled, but the disease is still there. And so we have to cope and manage. Therefore, provided that all these information and habits and suggestions and are given, the lockdown may be stopped safely in a country that has controlled the occurrence of new severe cases in the last weeks.
Mohammed, what happens if restrictions are lifted too early? What are the greatest risks?
Well, one of the obvious risks that we are seeing that within 2 days, over 200 flights were already scheduled to leave Wuhan. And because people who've been living in the Hubei province, they are halted for 76 days overseas, so they will be coming back. And we know that the disease isn't under control in those countries, and majority of the countries. And if it is on different scale, they are going to bring the virus as well. So it's not the danger only within the Hubei province, but also people who are traveling from abroad and overseas. But at the same time, I do understand that changing behavior is, of course, absolutely important to contain such kind of contagion. But at the same time, it is crucial that the uplifting that has been made now, or the easing out the curfew and the lockdown need to be monitored very, very closely, because the virus can emerge, very, very fair chances that it would emerge not only in one wave but in a second wave, for the reason that I described before. So extreme cautious is extremely required.
And Arisina, if the restrictions are lifted too early, we're told that a second wave would be more deadly. Why would it be more deadly?
I think the second wave actually maybe involve more elderly people, because maybe the first wave is more young and young or healthy people get infected. Now they're quite asymptomatic, and they resume to their work, and then they spread the virus to the local community, and then only the elderly, the people with chronic disease, they get infected. They are the one with a higher mortality, as well as because there are a large number of asymptomatic in the society. The spread of this of disease in the second wave will be much faster than the first wave. So at last, because our healthcare system has already handled this new coronavirus pandemic for a couple of months, our system has been a bit exhausted. If there is a second wave to come, maybe our system will collapse quickly.
Gloria, 10 weeks it lasted in China, in Wuhan. Italy, we all know how much Italy has suffered. You've only had it for 4 weeks. Do you think you're looking at another 6 weeks of lockdown, at least?
Well, I cannot predict how long the lockdown will last. Maybe 4, maybe 3, maybe 5. I don't know. I'm not in the rule and the position to make a forecast on this sense. But surely it will last for a while in Italy, because we are controlling, but we are not at the very steady state of the infection. And therefore there is some more cases appearing. And even if the request for intensive care units assistance is reduced, and the cases are not so desperately ill, still we have severe cases, still we have severe patients. Therefore, we have to check and we have to control that the quarantine and the lockdown will be maintained for a proper time. I would like, anyway, to have a vision I would like to share the results and the numbers based on which China decided to stop the lockdown, because this is the very important point. If they decided to arrest this decision and this measure, probably they have data that I would sincerely enjoy to share and to see, in order to imagine what can we wait and what can we imagine will happen in our realities, in our countries, and to make decisions based only on the experience of another country that had such a large number of cases.
Mohammed, what have you learnt from what's happened in lockdown, in Wuhan, from the way the lockdown was imposed? What has surprised you as somebody who studies all of this?
Yeah, I mean, one thing became very clear now that when China imposed the curfew and the lockdown, it was unprecedented, never been practiced in the history as far as I can recall. And everyone was really skeptical whether it would work or not. But now it has worked as per their calculations, and they are now getting back to normal. So that left quite a clear blueprint for the rest of the countries to follow. For example, Italian, without any hesitation, they were up to posing the draconian measures, mainly based on the data that was coming out from Wuhan, that it is working out and the number of cases are decreasing. So I think the best thing that we learned is that you need to take bold steps in this kind of bold disease. But the real question really lies here is that since most of the countries, they applied control measures taking China as a blueprint, now China has lifted that, that will also be considered as a blueprint. How would we phase out the restrictions over here in the Europe or in other countries? So it's really a lot to learn, and a lot has been learned. But the problem is really that the data coming out from China is relatively difficult to sometime access and sometime to analyze, because as Gloria mentioned that before, there is a certain criteria to decide when the curfew or lockdown need to be released. But I can't see any data that has been released based on that. They say that that is the reason that we decided to remove the draconian measures they've been putting in place, except that the number of cases gone to zero. So there is still a lot uncharted territory that need to be explored before we really translate that information for other countries.
And Arisina, aside from the problem of getting that data out of China, what have you learned from how the Chinese managed the lockdown in Wuhan?
I think during the, according to the news from the mainland, during the lockdown, the Communist Party, they do show a strong power how to control the activities of people inside Wuhan. Unlike other democratic or developed country, although the government still imposed the law of lockdown or imposed the law of forbidden any kind of activities, but we can still see that people are trying to go out to park and then everything, try to do the things they like. But in mainland, when the government imposed the law of lockdown and inhibited all sorts of activities, they have very strong army, many strong police or even secret police is everywhere of the city. And so they check the identity of people. So most of the activities are really prohibited during the lockdown period. Maybe that is one of the reasons why it seems the lockdown seems to be get successful quickly. But however, as I said before, we cannot clearly assess the situation in mainland well because we are lack of data coming from them. So we just guess the situation from what the little information what we get from the the mainland government and also from the official news.
Mohammed, I want to ask you about other options that might help people avoid a lockdown as long as they've had in Wuhan. There's been talk of this adoptive policy whereby you create waves, you relax and then you strengthen the regulations. When hospitals get full, you increase the lockdown. When people are released, you reduce the lockdown. Is that something that European societies might look towards?
Well, certainly that is one of the approach to sort of release the burden onto the healthcare system, but probably that will turn out to be too costly because that if that would be the situation, that is the same concept as is the herd immunity, which has been heavily criticized. So that is probably not really a good choice to go for. I think the best capabilities here in the Europe, I think, is really to enhance the capability of the healthcare system so that they can cope with every infection that require treatment or entertain in every capacity they can. But at the same time, I do understand the way lockdown was implemented in China cannot really be replicated in any other European countries because of our geopolitical and the personal choices we have here. So the timeline required to have the lockdown here in the Europe to see the same benefit that has been seen in China is really long. So we should not expect that within 60 days or 70 days that China has seen this impact we would be seeing in the UK or in any other European countries.
Gloria, that's the challenge, isn't it? It's unlikely, perhaps, to suggest that European societies, that Italian society would accept a 10-week lockdown. How do you have something other than that? Are there alternatives to that?
No, I think for the moment no alternatives can be imagined. But we have to imagine a future. So we have to have an idea of what is going on. Because after quarantine and lockdown have been stopped or will be stopped, the problem will not be over. And so we have to imagine a new way to handle with the disease, with the infection that will be spreading all over the world. And in that mindset, we have to remember that, as was mentioned previously, the second wave of the influenza pandemic in 1918 was much worse than the first one. And the third, there was also a third wave, was less severe. So it's not absolutely given that there will be a second or a third wave. Maybe yes, maybe not. But for sure, we have to imagine that the virus is spreading, is circulating. There's no way to stop its circulation. So we have to figure out that any patient, anyone who is walking down the street when the quarantine is and the lockdown will be stopped, anyone who is walking down the street is a potentially infectious person, even if he's unaware of being so. Therefore, we have to imagine that our lives will change until the herd immunity, which is mainly devoted and will mainly refer to younger persons that will make an infection a totally asymptomatic infection and will be protected after that. But the problem is to protect the oldest one, as my colleague told from Hong Kong, and also to protect all the person from the potential spreading of the virus by an unaware infectious person. Therefore, wearing mask, clearing hands, and maintaining a safe behavior will be the key of the controlling of the infection in the future.
Mohammed, I'd also like to ask you, obviously the idea of herd immunity is a very controversial one because of the amount of people that need to be infected before you achieve herd immunity. But if you don't go for that, what is our exit strategy?
Well, the exit strategy is really the suppression, to really limit the spread of the infection and to intervene with the transmission within the community so that the number of people that are infected and needing hospitalization can be reduced. So that will, of course, have two advantages. First is that a burden onto the healthcare system, but at the same time allowing more time for the vaccine.
And Arisina, one last question to you, please. Are the lockdowns on their self enough, or is there more that you need to do as well as lockdown?
I think, as Gloria said before, besides the lockdown, we do need to change the behavior of the people, make sure that during the lockdown, people do adapt social distancing and also improve the hand hygiene and also wearing masks. From what reported from some Hong Kongers who stayed in Wuhan previously during the lockdown, actually, the sense of public health and social hygiene of people there are not very good. Masking is not very common, and also they at the beginning of the lockdown, they still find some places are actually in poor hygienic condition. We are not sure that after these 10 weeks of lockdown, whether the government there has also educated people about the social distancing and also the masking, wearing masks and social hygiene, and also the hygienic things. We hope that when Wuhan people or when other people from mainland in other parts of mainland, when they are allowed to travel to different parts of the world, they can have a better behavior wearing masks, because we expect that there is quite a number of Chinese from mainland. Actually, they may be the silent carrier of the SARS-CoV virus.
All right, we're out of time, unfortunately, but I'd like to say thanks to all our guests, Dr. Arisina Ma, Dr. Mohammed Munir and Dr. Gloria Taliani, and thank you too for watching. You can see the programme again anytime by visiting our website aljazeera.com, and for further discussion, go to our Facebook page, that's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Bernard Smith, and the entire team here in Doha, bye for now.